Hi there, my name's Roland Rees. I'm a urologist in the UK and specialise in male genital urethral surgery. And today we're going to talk about the Optilume device. This is a new balloon dilator for urethral stricture disease, and it's a balloon that's covered in a drug called paclitaxel. So essentially a new technology. Previously, we've treated strictures, certainly initially, with a straightforward dilatation or urethrotomy, which is a cut with a fine blade, or urethroplasty, which is the more invasive and the more sort of permanent, if you like, treatment. How is this done? I'll show you here. Here's a stricture on the screen. There's a narrow opening. The urethra should be, of course, this wide, but it's a scarring causing a narrowing. That's what a stricture is. And here's the Optilume balloon being passed. So it's passed over a wire through the little hole, and then it's dilated, it's blown up essentially to stretch up the urethra, and then it is allowed to sit there for 7 minutes or so whilst the drug is absorbed into the lining of the pipe, and then it's taken out. And it's quite simply, it's a daycase procedure. There's no catheter involved. And then the results, what are the results of this thing? Well, it seems to be superior to standard treatment. So if you have a traditional dilatation or urethrotomy, and at best you're looking at a 50% success rate in the medium term, so in the 4-year sort of time frame. With this, the 4-year data would appear to come out as around 70%. So it seems to be superior to traditional therapy. Now, of course, if you look at urethroplasty, then the results are better still. So at 10 years, if we compare like with simple bulbourethral strictures, then 85 or 90% of people will do well with urethroplasty. But of course, that is more invasive and it involves a longer stay. It involves a catheter for 2 weeks, whereas this is an in and out daycase procedure. So I do think it's got a place, and it may well be that we do use this for most recurrent bulbourethral strictures and other strictures in the anterior urethra in due course, certainly in situations where urethroplasty is not possible or not advisable. In terms of downsides, very few, and that's a good thing really, is that there aren't many problems with this device because it's removed. There's nothing left behind essentially. And so apart from maybe some bleeding, urinary tract infections rarely afterwards, there aren't really any major problems with it. If it does fail, then yes, you can have a urethroplasty subsequently. And I think that's important to point out, that doing this doesn't affect or compromise any subsequent treatment either, according to surgeons who've done urethroplasties following this procedure. So overall, I think it's got a place in the management of urethral strictures, and we'll obviously wait the long-term data as well with interest.